Good morning, everyone. Thank you so much for joining us on our every other week press conference where we share what is going on in our community with the COVID meter, in our emergency rooms, at our doctor's offices, with vaccinations, with COVID generally. Today, we have some good news and we have, on my behalf, some bad news. So I'll start with the good news. The good news is that our numbers are going down significantly, like we are seeing around much of the rest of the country, and maybe better than some places around the country. And I believe better than what we're seeing in Southern Nevada. We'll be hearing all about that in just a few minutes. So the numbers are really looking good. Our predictive tool has been working very, very well. I think it's been spot on, except one or two times. It's in beta testing anyway. So you'll hear a little bit about that. And then today with us, we have Dr. Bayo Curry-Winchell, to talk to you about what is going on in the kind of the clinic setting, the outpatient setting. And we have Dr. Brett Fry to talk to us about what's happening in the emergency room and in the hospitals in general. So I've already mentioned the good news. The bad news. The bad news is that people are still getting sick, people are still being hospitalized, and people are still dying. I myself, just this week, lost my 22-year-old nephew. And it was rather stunning. And it was a complex situation. I've been talking to our doctors locally. It may have been a complication with something called ITP, which is low platelets, virtually no platelets, right down to another thing called multi-system inflammatory syndrome for children. There's also one for adults. It's where you get COVID. You may or may not have a bad case. You get better, but then maybe a month later, you get really, really sick. To the point that you have to be hospitalized. In my case, my nephew was hospitalized and within about 24 hours. I mean, he was care flighted to a bigger hospital. He did die. He lost his life. So we had that event to this morning. I haven't really told no one. No one really on this call even knows, but I'm saying it today because we just had the Zoom funeral, something no one wants to go through. That was my first thing at 8 o'clock this morning. And to lose a young person at 22, 4.0 student, you know, in electrical, mechanical, computer sciences, headed for law school and about to get married, who we don't have in our family anymore, is just devastating. So my heart goes out. We just had a milestone nationally where we had over 500,000 deaths, 500,000 deaths. Unfortunately, my nephew is now one of them. So many people in our community have gone through this. Some have weathered it very, very well. Others have gotten very sick and others have passed away. So on that sort of down note, the good news, back to the good news, is that we're going to hear that things are really improving in our community. The whole concept here is that as we get better, as we vaccinate more people, we want to make sure that people maintain their masking, their social distancing, until we really understand if when you get vaccinated, you can still transmit the disease, and really what that looks like for our whole community. We want to be able to open. I mean, at the end of the day, we want to get back to something resembling normal life. So I think if we all pull together with these declining numbers, we're going to be able to achieve that, and we're going to have far, far fewer deaths. And the statistics are proving that out locally. So with that, thanks for hearing me for a moment. I do want to hand it over to Dr. Jeremy Smith. As you know, he is our director of the Truckee Meadows Regional Planning Agency, where we are housing the COVID risk meter. He's the primary architect of that with a team. And so with that, Jeremy, if you want to take it away and talk to us about the good news.
Councilwoman Maduro, thank you very much for that intro. And I'm really sorry to hear about your nephew. And I think it just really underscores how important it is that even though we're going to show some really good news right now, and we're totally heading in the right direction, I just want to, echo, we need to stay diligent, social distancing, wearing the masks, and making sure we really put this thing to rest. We don't want to back off now just because things are starting to open up a little bit. But let's take a look at the numbers because it is looking really good. Sharing the screen right now. So here we go. Here's the COVID risk meter. Today I have the Spanish version for you because we have the site fully translated to Espanol. So that's fantastic. We're still in the first tick of the orange category, but heading towards yellow. If you look down to the daily scores, you can see that it's actually yesterday was a 4.5. And so that's squarely in the yellow zone. We've got a few days in yellow, so we're heading in that direction. Let's take a look at each of the individual indicators. This is the risk assessment data received from the Washington County Health District. You can see really continues to go downward. So great trend here. Less people are feeling sick and less people are calling in to get a test at this venue. Likewise, test positivity. Test positivity has continued its decline. I mean, I keep waiting for these numbers to change direction, but they haven't yet, and I'm really excited about that. Yesterday, down to 7.3. I just checked it for today. The value is 6.8. And so that means that's crossed below the next threshold in our model, and test positivity is now only going to be scoring 1 point. So that's really going to help bring us down into that yellow zone if that persists. Likewise, we have reached that same level with new cases daily. We're down to around an average 7-day average of around 8 new cases daily per 100,000 people. And our threshold for that model setting is 9. So we're underneath that now, and that's helping bring us down. And really, it's just that's the model side, but it's reflecting what's happening in our community. The number of new cases daily, it just continues to diminish, which is great. In terms of hospitalization, medical interventions, this is quite a bit going on this slide, but draw your attention to the graph on the left. The dark blue line is an average of how many patients are in our North Region hospitals with COVID. Back right around Christmas, it was well over 400, now down to about 70. So massive difference in terms of the burden to our hospitals. Similarly, the ICU burden has come down tremendously too, from approaching 100 COVID patients in the ICU today down to around 11 or 12. It's a 7-day average. So really fantastic. These graphs on the right just sort of show the progression through time all the way back to August for those two things. And you can see this big mountain of blue represents when we had that peak of COVID patients. Likewise, this big mountain of blue on the bottom represents when the ICU got filled up. And I think what you can tell is that if you look at the very far right side of those graphs, we're starting to get back to what we looked like on the left side of that peak. And so we're heading back to that pre-Halloween level. Finally, overall hospital capacity and utilization of our staffed hospital beds and staffed ICU beds looking really good. In terms of the North Region hospitals, we're about 77 or 76% utilization. So we've got a lot of slack in that system to accept patients right now. Likewise, in the ICU, about 62% utilization. So across the board, all of the indicators are looking amazingly good. Oh, went too far. And so here's the cumulative indicator score. You can see back in December, it was up in that red, approaching the purple boundary. Now, very far right, we had 3 days in the yellow last week. And so if that trend persists, we're very confident that if that keeps going that way, we're going to be into the yellow for the next week gauge setting. And with that, I'd like to turn it over to Dr. Aditya Nair, who can talk about how we got to that prediction.
Thanks a lot, Jeremy. Appreciate it. And yeah, so this is just a one picture update of what the predictive model is being doing and what it's looking like. Just echo Jeremy's comments. Things are looking good, but we need to exercise caution, like Councilwoman Doer said. But just showing you here the comparisons for the prediction and the true data that Jeremy was showing for the month of January and the month of February. And you can see it's not been off much. In February, actually, it's been off for just 4 days in total. So I think the predictive aspect of the meter is working. The meter in general is working in terms of giving the information as to what's happening on the ground. And the two key factors have been the reduced load in hospitalizations, especially the 4B indicator, which was the number of COVID ICU patients. And now the indicator has been the new daily cases, which has been going down. And you can see in my prediction, which is the last, this week, basically, it looks like we are going to be in somewhere in the moderate 2 or in the yellow regime fully, or at least the hope is that that happens. But yeah, I think the predictive meter and the data has been really, I feel like following what is happening on the ground really well. Over to you, Councilman Madua.
Okay, thank you. Great work, Dr. Smith and Dr. Nair. I mean, the tools that we've been developing, I know that you're even working on a professional paper, so to share this with the rest of the scientific community, and even thinking about some other kind of papers for the policy and epidemiology type community, public policy, public health. So keep up all the really good work. Next, I'd like to turn it over to Dr. Fry. What is happening in our emergency rooms and in our hospitals?
Hi, Naomi. Thank you for the segue, and I'm happy to report that the front line looks very good right now. We're seeing our COVID cases drop precipitously, and we're seeing some of the normal volume come back that obviously has been, unfortunately, sometimes putting off some really important health considerations. Just from a population health perspective, we're so behind on screenings, cancer screenings, and other really critical ongoing chronic condition management, that I really encourage people out there that have chronic conditions that need to be managed, screenings that need to occur, to really contact their local doctors, and that we can make sure that those cancers that are lurking are found, and that the disease that folks have is well managed and doesn't get out of control, leading to unfortunate hospitalizations and even worse outcomes. What I will also report is that the vaccine acceptance rate in the categories that we vaccinated so far has been very good. I think that the medical community is now segueing to what happens next when we get into the 16 to 64 category, and what is our acceptance rate going to be? Because if we're going to avoid a third spike, which I think is on everybody's mind with the new variants that are out there, how bad could a third spike be if we don't accelerate to herd immunity? So I would encourage everybody that is in the, that's on the fence about getting vaccine, that it's really important to consider what it means for our community, what it means for our economy, to, when the dose is ready for you, gladly accept it and help us all move forward. Vaccines the answer, what's the question, I like to say. And I really hope that, and I'm confident our community is going to rise to the occasion and accept vaccine when it's available for them. Thank you.
Thank you so much, Dr. Fry. I think you made some outstanding points. They hit home for me. My husband's over 65. They just opened up the, if you'll call it the lane, to allow the folks that are over 65 to get vaccinated. And now those folks are joining those over 70s who are having to call all over our town looking for a place that they can get on a list and get an appointment. So it just opened up. I heard there's something like 40,000 people in that category. And there are 4 major places, and I think about another 5. And in fact, the district health is going to open for over 65, I heard on Friday. And they still have their waiting list for people that they had opened up for 65 to, 65 and over. They were only focused on the 70. I talked to Heather Kerwin over there yesterday, and she said that they're actually expecting to work their way down from 69 to 68, 67, 66, 65 on their call list. And they're mostly working on people that they're calling, because the people that have electronic means, email, can usually figure it out and get vaccinated somewhere. But the people that don't have those electronic means are really needing the outreach from the district health. The other thing I wanted to just comment on, your point about screenings. I know myself, I've got at least 3 pending screenings. I've been making it to the dentist, which is good, but the eye doctor is way behind. I would like to update these glasses. But first I need a new prescription, and I had to miss my appointment, as you've just heard. And so I'm another month out, again, 2 months out. And if I didn't take that appointment, it was another month. It wasn't like, well, 2 days later. It's literally so stacked up that they're only being able to like take 10 people or 15 people a day at most, for the eye screening. So that's challenging. And then your point about the acceptance of vaccines, I just wanted to reiterate something else that I heard recently, which is that apparently in the school district, some 90% of the employees are taking the vaccine, to put it in a colloquial way. But to your point about the acceptance, it seems really good. So to that, let me turn to Dr. Curry Winchell and let's hear, what are you finding, Dr. Winchell?
Good morning, Councilwoman Durr. And again, I'm sorry to hear about your loss.
I am keeping it together, but check with me after this call.
Oh, I will. I already planned on checking with you. So as Dr. Fry mentioned, we are, seeing a decrease in requests of testing as well as cases and so forth, which is just an amazing attribute to our community and how well we are really being mindful of the social guidelines of distance and hand washing and mask. And so we are seeing the effects in the outpatient world. We still continue to see quite a bit of complications from COVID. I had a patient yesterday who was diagnosed a couple of weeks ago and unfortunately still was suffering from dizziness as well as just that kind of mind fog, brain fog that we've all heard about. And so the reason why I bring that up, as well as when Councilwoman Durr mentioned her nephew, if you are having any sort of complications, if you've recently been diagnosed with COVID, please seek help. And I think when we talk about preventative measures, when we talk about staying healthy, as well as if you've been diagnosed with COVID, so important to go in and be seen because time is the essence. And so that's just something that I really want to stress. Utilize your primary care, your urgent cares, or the ERs in hopes that we can, rectify or delay unfortunately, another complication. In regards to vaccinations, I am happy to see our community is really increasing their buy-in into taking it. We still have work to do. This is something that I know our task force is very committed to and our community as far as addressing vaccine hesitancy. And that's something that I am looking forward to how we can really, have conversations with our faith leaders and our medical community, as well as, different local celebrities and so forth, in hopes of providing that information on how beneficial the vaccine is. And I encourage, anyone who has concerns, reach out and ask those questions because that's the way you can really, help yourself, help your community. As Dr. Fry mentioned, we all want to return back to our level of normalcy. And so the more you can do that, how you can do that is taking the vaccine, asking questions, and utilizing all the great resources we have here in the community. So continue to wear your mask, wash your hands. This is something I always like to say that was important before the pandemic. So that's something that we should continue on and so forth. So thank you.
Dr. Curry Winchell, just to follow up on that, you mentioned if you get it, come and see your doctor, but are you saying just if you're having symptoms? I mean, a lot of people will get tested because maybe their friend had it, someone in their family, maybe they're not themselves feeling ill. Are you saying just if you start feeling symptoms that you don't think you can handle? Or when would you go to the doctor, bottom line?
Absolutely. So if you do have symptoms, it's very important that if you have fever, a cough that is not controlled with over-the-counter medicines, generalized fatigue, decrease in appetite, all of those factors are really important that you seek medical attention. Now, if you've been exposed and you think, I might have contracted coronavirus, just to help yourself and your community, get tested because that helps us, reduce the spread.
Okay, that's a great message. I think I'm not sure that has been getting through, is that it's still important to actually get tested and get a diagnosis potentially.
Yes, absolutely.
Are the tests any better? I mean, we're hearing, have they changed at all? I mean, there was sort of a certain percent that were false negative or challenges with positive. Could you just address that for a minute?
So our tests have, stayed the same. One thing that I'm really grateful for as a physician, the turnaround time has decreased tremendously. Before we were dealing with about 4 to 7 days as far as the turnaround time, but now with the state lab as well as our local labs, Questa and LabCorp, the turnaround has been between 1 and 3 days. So that has really been helpful for us to be able to get that information to your patients as well as mitigate, potential exposure.
Okay. Thank you. Thank you both so much. You and Dr. Fry, you have been stalwarts, helping us all through this the entire time. We couldn't do it without you and your communication abilities to get out the messages. So with that, I would like to turn it back to John Humbert. And John, there may be questions from the folks attending.
Yeah, certainly. We've got our normal crew here. We'll start with channel 2. If you guys, Cynthia or anyone else with the station, have anything. All right, we'll move on to Kristen.
Hello. So the South African variant of COVID-19 was detected in Washoe County. So how does that play into the predictive model of this of the meter?
First of all, before we get to the meter part of your question, maybe we could just get confirmation from the two doctors about that.
Yes, so it has been detected. And the one thing I always like to talk about when we talk about variants, everyone is always concerned because of the transmissibility and the infectious rate. But we have to be mindful to remember we know what to do to combat, transmission. So although there are several variants and this will continue to happen, it's all about maintaining those guidelines in hopes that we don't contract it. So I'll let Dr. Fry.
Thank you. Hopefully my connection is still good. Yes, to dovetail on Dr. Bayo, we still believe that the vaccine is quite effective at preventing serious disease, and we're seeing that a number of countries such as Israel that have widespread high vaccination rates already are seeing significant reductions in overall hospitalizations, and if we can really accelerate to herd immunity, that's our best defense against a third spike. And whether or not that third spike involves a variant that perhaps can spread more effectively remains to be seen. But I think we need to, do the full court press and continue to mask up, move forward, hand wash, distance, and keep this economy open, even as we double down on the efforts to squash it.
So in terms of the meter, I mean, the meter, both the prediction part and the actual part reflect what's happening with the spike that Dr. Fry just mentioned. So, I mean, do you want to address that, Jeremy or Dr. Nair?
Absolutely. Yeah, that's correct. I mean, there is nothing in the COVID meter code right now that specifically addresses variants. But if those variants would propagate increased case proliferation, then we're gonna pick that up, and that's gonna register in the risk that gets reported.
And just to piggyback on all the points made, like Jeremy mentioned, there's no explicit dependence of the variants. But in speaking to Dr. John Hess, he also mentioned that the symptomology of the new variants would be critical in understanding that. And there's not enough data, basically, we can use basically to incorporate in the model. So that is something that we definitely plan to do if and when that becomes a major issue. So really good question, Christian. But yeah, I think we are still in the I think there's a big data availability issue in terms of incorporating it in the model. So.
Okay, thank you very much.
Good stuff. We'll move to Scott next.
Yes, thank you so much for this information. What are you hearing is the biggest part of the resistance to getting vaccinated? Is it side effects? Is it efficacy? What are you folks hearing?
I can take that. I'm hearing most people cite concerns about how they're going to feel after the second dose and whether or not it's going to be as effective given the new variants that are out there. And again, I think that the important thing is that this is an incredibly safe vaccine. It's one of the safest ever developed in the history of vaccines. And we are not seeing people show up to the emergency department because of a second dose. They are going to potentially feel pretty achy and may need to take the following day off work because they feel so bad, but it's pretty uncommon, if not rare, to have to go to the doctor or the emergency department because of a second dose. So I think it's a big trade-off, right? We have to understand risk, and the risk is far lower for a second dose than it is to remain unvaccinated and potentially get the illness.
And then I just wanted to add, from the BIPOC community, for communities of color, there is a lot of mistrust, and that lies in the fact of so many different things that have happened in our public health system. And so that's why we really have to have those intimate conversations to state, just like Dr. Fry mentioned, it is a very effective and safe vaccine. But when you have thoughts of, concerns of what's happened in the past, the Tuskegee experiment, other things like that, until you acknowledge that, it's very difficult for people to really take in the information that this vaccine is safe. So it's wide spectrum, but important to mention that, communities of color, that concern has been present in the past and it's still present now. And it just takes time for people to really embrace this vaccine, although it is safe and effective.
All right, we'll move on to Mike now.
Hey guys, Dr. Fry, if you could just elaborate a little more when you say this is one of the safest vaccines that's ever been created. Can you explain a little bit why, for anyone that might still be confused, just what it contains, I guess?
Well, yes, it's certainly the Pfizer and the Moderna are messenger RNA vaccines. So they use your cellular machinery to basically, trick your immune system into thinking you have the virus and that it needs to develop antibodies. So other virus that has, plagued the planet, we've developed live virus vaccine and killed virus or attenuated virus vaccines, which tend to, on the whole, if you look at the aggregate response throughout history, tend to be a lot more reactive. And some of those folks do end up in the emergency department when you're talking about live virus. This is not a live virus. This is not a killed virus. This is not an attenuated virus. This is a messenger RNA vaccine, which is just a whole lot safer on the whole than any other vaccine we've administered throughout history to tamp down pandemics.
Any follow-up?
I'll just add a point about the vaccine. The notes that we have are about 100,000 folks in our community, or doses, have been administered. Now that could be a first dose or a second dose, but about 100,000 doses. So that is showing some good acceptance. And it says about 36,000 people have received both doses. So again, we're on our way. We already talked about the 65 to 69, but it looks like Walmart is starting to open up their signups now. And I think they're the first. And so I think starting Friday, as soon as Friday, they'll be able to start vaccinating people. Just another note on vaccinations. And I mentioned last time, I just wanted to get this out, the phone number to call if you need assistance to getting vaccinated, you're having troubles, you can't find a place, you don't know how to do it. I'm going to give you that number one more time. It's 1-800-401-0946. So that's 1-800-401-0946. And they're open 8 a.m. to 8 p.m. And that's something I think the media can help us get out there in terms of the vaccines. So, and we might have some other stuff for you later, but back to you, John. Thank you.
Wonderful. Thanks so much. We'll wrap it up with Bob from the Serena.
Hey, there are no questions. Thank you, though.
All right, fantastic. Anybody else? We've got two, Kristen, Scott. Anybody else from Channel 4 as well?
I have an interesting story to share.
By all means, go ahead.
So my neighbor, who I just, think is a fantastic, both my neighbors are just fantastic. They're retired healthcare providers. Dr. Veazey, who's a retired infectious disease expert, actually was instrumental with his team in India. He headed up a team of about 400 people to go into India and do some of the final vaccinations against smallpox in order to tamp it down in the mid 70s. And of course, famously, we were finally able to eradicate smallpox with the last case, I believe, in Somalia in about 1977. His stories about how he needed to educate and really talk to the local leaders in Indian villages throughout the country to help them understand the importance of the vaccine. And I think a few payoffs might have been in order as well. He describes some pretty harrowing tales of bags of money to pay off local leaders in order to get vaccine administered to those folks. Fortunately, we're in a different day and time, but it just goes to show you it's a heavy lift to get vaccine administered to enough people to really eradicate something on the planet. And I applaud him for his efforts on this call.
Thank you so much, Dr. Fry. That was extremely meaningful. I mean, human beings, we have been managing our lives and managing what affects our lives since forever. And that's an inspirational story that he is still around to tell that and is in your neighborhood and is one of our own community members, really kind of bats at home. And I have a feeling that you and Dr. Curry Winchell and the other doctors in our community, you are constantly inventing ways to deal with this illness. I saw that we just had 14 more people admitted to the hospital and a couple more deaths. And so you're still extremely needed. Hopefully you guys have been getting a little bit of rest recently with at least being able to rotate out with some people so that it's not all you all day long, every day. So for that, we really appreciate you. With that, we'll wrap up. One final note on the vaccine. I think most people know this, but it's always good to get this out, that there is a really good website. I was on it just myself last night, COVID-19 washovaccine.com. So COVID-19 washovaccine.com. You can find almost everything about it, where you can get it, who's eligible, what lanes, what tiers, what places, how you sign up. They're really doing a good job of getting the information out. Every week they get better at this. So a huge shout out to our health district, who is trying to manage this vaccination program for our whole community. So with that, John, I think we are ready to wrap up for today. Thanks again for joining us. And I say this every time that I get, that I'm on with you, which is thank you to our media partners for getting all this information out. If not, we'd just be talking to ourselves. So thank you for what you do with the rest of our community.
Fantastic, everybody. And as always, if you need any of the recordings, we've got them on the cloud and we can easily pass those along to you. So thanks so much. And we'll hopefully have some more good news coming up in the next 2 weeks. Let's all do this, guys.
We're going to yellow.
Going to yellow.
All right.